Mark, hi folks. So before I talk about how we're evolving our cancer services for customers, I thought it'd be useful to give a quick update on our overall pre-auth volumes and trends. So in summary, we're now well out of the Christmas wave of COVID and hospital services are pretty much back to normal. And we're firmly into what we've been calling the bounce back. So in other words, that's where activity is running above pre-COVID levels as the private sector tackles the backlog in delayed cases that built up over the past 12 months. So I just want to give you a quick sense of that. So pre-auths for new care journeys have been running above pre-COVID levels since early March. And last week we're running above pre-COVID levels by about 20%. So you can see that's a material increase in our normal activity levels. That hasn't yet flown through into pre-auths for ongoing care. So pre-auths for ongoing care have been steadily rising since early February and are now only just below pre-COVID levels. And there's about a 3 to 4 week lag between that new journey starting and customers coming back for treatment. So we'll see where this goes over the next 3 to 4 weeks. But right now, if you combine those two things together, total pre-auth levels are above pre-COVID position. And as I mentioned, we're expecting those to continue to climb over the coming weeks. So that's a really great picture there. So right, let's switch back to today's main topic. So Sarah highlighted how COVID has impacted on cancer services, disrupted diagnosis of new cancer patients, and discouraged many people with symptoms from coming forward to access care. For Bupa customers, private cancer services were largely unaffected despite the restrictions in other areas. Overall treatment activity for patients that had cancer at the start of COVID was pretty stable, although we did see change in the way that treatment was being undertaken. In particular, the number of cancer surgeries did fall over the COVID period, and that's particularly in light of the heightened mortality risk from contracting COVID post-surgery. And as a consequence, we saw changes in the way that care was being delivered. So the chemo courses were extended. We saw greater use of trial phase drugs that Bupa funds through our Cancer Promise. So increased use of radiotherapy, so an increase in the number of customers using oral rather than IV medications, so avoiding having to come into hospital. As well as a doubling in the use of at-home chemo services. So it was really great to see Bupa's proposition enable the care for so many patients to be adapted to the challenges that COVID presented over the past year. However, we did also see a big reduction in the number of customers seeking a new cancer diagnosis. This is the graph I'm showing here, a very similar picture to the one Sarah showed. And you'll see that pre-auths dropped by about 45% between March and July 2020 versus the prior year, so pre-COVID. And this was despite diagnostic services being largely available in the private sector and lots of messages from us to try and encourage customers to seek help if they had worrying symptoms. Now, thankfully, this position started to reverse in late February. And you can see at that point, the number of new cancer cases entering the system exceeded pre-COVID levels for the first time. And over the past 4 weeks, you can see that that line just shoot upwards, that red line shoot upwards. And so in cancer, what we've seen over the past 4 weeks is that new referrals are up 30% on pre-COVID levels. So overall, we're expecting about 90% of the delayed cancer cases will eventually present themselves. The balance comprises individuals whose care switched to the NHS during the COVID period, which is a surprising thing that we weren't anticipating, but that we did see that happen. There's also a number of patients whose symptoms would have been benign and have since stopped, but also sadly individuals that will have sadly died during this period. So we think that if the current run rate of new referrals continues, I hope that any delayed Bupa cancer cases will have been diagnosed and be in treatment within roughly the next 4 to 5 months. So that's quite a quick recovery that we're hoping to see in the private sector. So I just want to move on now to some of the changes we've seen in access to care. So as well as changes to treatment approach during COVID, providers also quickly implemented new ways to access services and care, many of these digital. The step change in GP and specialist consultations being provided remotely in the NHS has been really impressive. That said, access to GPs continues to be a challenge for many people. And as Sarah was explaining, speed of access in cancer is absolutely paramount to a successful outcome. So for Bupa customers, any member who is concerned about possible cancer symptoms can use our direct access service. And this means they can speak directly with our clinically led team to assess their symptoms without the need for a GP referral. Customers will be referred to a consultant in an average of 6 days and start cancer treatment within 29 days, which is twice as fast as the published national targets of 62 days. And we've also recently launched a Get Treatment section on our websites, and this is to better signpost customers to the direct access service. And it also highlights some of the other services that Bupa provides to support customers during their cancer journey. We're continually working to improve speed of diagnosis and quality of care for customers. I just wanted to highlight a few other examples of these. So in skin cancer, almost all skin cancer patients that are diagnosed at the earliest stage will survive the disease for 5 years or more. And that compares with only 7 out of 10 people surviving when diagnosed at the latest stage of the disease. In June 2020, we launched a new remote skin pathway, and we've seen steady increase in the use of the service since then. The service provides customers with an imaging kit that is posted to their home and uses app technology to share the results with and get a diagnosis from a dermatologist within 24 hours. Since launching, almost 2,000 customers have now used the service, and the feedback we're getting is really, really positive. So moving on to breast cancer. Breast cancer is the most common cancer in the UK and accounts for about 15% of all new cancer cases. When diagnosed at its earliest stage, all people with breast cancer will survive their disease for 5 years or more, but that drops to only 1 in 4 when the disease is diagnosed at the latest stage. In 2019, we established a number of breast cancer specialist centres where someone with symptoms can visit a specialist within 2 days of referral. They can access all the tests they need in one visit and get a same day all clear or initial diagnosis. And if the customer does need treatment, this will start within 31 days from referral, and that's half the published national target. We've been expanding the service since launch, and we now have 11 sites across the UK that are working to these standards. And by the end of the year, we expect to have expanded that to 14 sites. Bowel cancer. Bowel cancer is the 4th most common cancer in the UK and accounts for about 11% of all new cancer cases. Diagnosed at its earliest stage, again, almost all survive for 1 year or more. But that drops to only 2 in 5 people when the disease is diagnosed at the latest stage. So later this year, we'll be launching a number of bowel cancer specialist centres that offer our customers fast access to diagnosis and treatment, whilst using learnings from the breast specialist centres that we've already established. As Sarah explained, employers can play a really important role in raising awareness of cancer symptoms, ensuring colleagues are diagnosed as early as possible, and supporting customers during their treatment and recovery. If someone is diagnosed with cancer and are covered with Bupa, they should rest assured that we will look after them throughout their cancer journey. It's not just the treatment, we're also here to support patients and their families holistically. Our Live Well with Cancer programme is a holistic care programme led by our oncology nurses. It begins with a holistic needs assessment to understand the patient's needs and concerns across multiple areas, and we then provide tailored support, which could include talking to an oncology nurse, mental health support, or counselling for cancer patients. I know Jenny will touch on this shortly, but when businesses are there to support their people with the right level of support and the right type of support, it can make a massive difference to someone's cancer journey. And where possible, patients who want to return to work are supported to do this. We know research that staying productive and retaining a positive mental attitude really helps improve outcomes. I hope this was a helpful overview about the trends that we're seeing at Bupa and how we're here to support our members.